Hello, beautiful people. Yes, we get it. Hair loss is a very distressing problem. Hair loss can be deeply unsettling, especially when you're trying to figure out what's causing it. While genetic factors and underlying health issues often play a role, many people are surprised to learn that certain supplements and medications can trigger or accelerate hair thinning. In this video, we'll explore how specific supplements and medications contribute to hair loss, incorporating research findings to give you a clearer understanding of why this happens. Supplements that can cause hair loss. Many supplements that are taken for general health or specific beauty benefits can have unintended side effects when consumed in excess, particularly when it comes to hair health. One of the most common offenders is vitamin A. While this vitamin is crucial for cell growth and a healthy immune system, studies show that too much vitamin A can actually cause hair to shed. According to research published by the American Academy of Dermatology, AAD, over-supplementation with vitamin A can accelerate the hair growth cycle, pushing follicles into the shedding phase, telogen, prematurely. This is because vitamin A affects the production of sebum, the oil that keeps your scalp healthy, and when it's out of balance, the hair follicles become overactive and enter a resting phase sooner than they should. It's important to stay within the recommended daily limits, especially if you're using supplements that combine multiple vitamins. Selenium is another supplement known to cause hair loss if taken in excessive amounts. A study conducted by the National Institutes of Health, NIH, found that high levels of selenium can lead to toxicity, which manifests as hair thinning or even brittle nails and skin rashes. Selenium is essential for thyroid health and protecting cells from damage, but overloading the body with it can disrupt the natural processes that maintain healthy hair. The NIH recommends a daily intake, RDA, of selenium that is carefully monitored to avoid these adverse effects. The RDA for adult men and women 19 years and above is 55 micrograms daily, and pregnant lactating women about 60 to 70 mcg daily. Most seafood contain high levels of selenium, so do take that into account. Similarly, zinc is a vital mineral for immune function and enzyme regulation, but too much zinc can interfere with the absorption of other key minerals like copper. Research from the Linus Pauling Institute points out that excess zinc can inhibit copper absorption, which can negatively affect the body's ability to produce melanin, the pigment responsible for hair color. This imbalance can lead to not only hair loss, but also changes in hair color. Therefore, zinc supplementation should be carefully balanced to avoid disrupting the mineral equilibrium in the body. Surprisingly, even vitamin E, which is often marketed as beneficial for skin and hair, can contribute to hair loss when taken in large doses. While vitamin E has antioxidant properties that protect hair cells, excessive intake can cause oxidative stress, which actually damages the hair follicles. According to a study by the Journal of Cosmetic Dermatology, people who over-supplement with vitamin E are more likely to experience hair thinning because the excess antioxidant activity disrupts the hair's natural growth cycle. Moderation is key, and it's always best to consult with a healthcare provider before starting high doses of any supplement. Medications that can cause hair loss. In addition to supplements, several medications have been linked to hair loss. One of the most common types of medications associated with hair thinning are beta blockers, which are often prescribed for heart conditions and high blood pressure. A study from the British Journal of Dermatology notes that drugs like propranolol and metoprolol can cause a form of temporary hair loss known as telogen effluvium, where more hair enters the resting phase of the growth cycle and falls out. This side effect is usually reversible once the medication is adjusted or discontinued, but it can be distressing while it lasts. Researchers speculate that beta blockers interfere with blood flow to the scalp, reducing the nutrients and oxygen available to hair follicles, thereby triggering hair loss. Antidepressants are another common class of drugs linked to hair loss. Selective serotonin reuptake inhibitors, SSRIs, such as sertraline, Zoloft, paroxetine, Paxil, and fluoxetine, Prozac, can disrupt the hair growth cycle, leading to thinning hair. According to findings from the Mayo Clinic, antidepressants may alter hormone levels, especially those related to stress and anxiety, which can have a direct impact on hair health. When hormone levels fluctuate, it can trigger more hair follicles to enter the telogen phase, causing hair shedding. If you notice hair loss after starting an antidepressant, it's important to discuss this with your doctor, as they might be able to adjust your dosage or recommend an alternative medication. Hormonal medications, including birth control pills and hormone replacement therapy, HRT, are also known to affect hair health. Birth control pills, especially those with high androgenic activity, can lead to hair thinning, as they increase the levels of androgens, male hormones, in the body. Androgens, particularly dihydrotestosterone, DHT, are known to shrink hair follicles, leading to androgenic alopecia, a form of hair loss seen in both men and women. According to a study published in the Journal of the American Academy of Dermatology, certain birth control pills, particularly progestin-only pills, are more likely to cause hair loss in women who are genetically predisposed to female pattern baldness. Similarly, men who take testosterone replacement therapy, TRT, might experience accelerated hair loss due to the conversion of testosterone to DHT, which is a known factor in male pattern baldness. Lastly, thyroid medications can lead to hair thinning, especially in cases where the medication isn't fully regulating thyroid hormone levels. Thyroid hormones are crucial for maintaining a healthy hair growth cycle. Research from the American Thyroid Association highlights that both hypothyroidism and hyperthyroidism can cause hair loss, and medications like levothyroxine, used to treat these conditions, may exacerbate the issue if dosages aren't carefully managed. Once thyroid levels stabilize, hair growth usually returns to normal. But if the medication is too strong or not well balanced, hair loss can persist. The mechanism behind medication and supplement-induced hair loss often lies in how these substances interfere with the hair growth cycle. Hair grows in a continuous cycle with phases of growth, anagen, rest, telogen, and shedding, catagen. When a medication or supplement disrupts this cycle, often by pushing more hair follicles into the resting phase, the result is excessive shedding, also known as telogen effluvium. In other cases, medications affect hormonal balances, particularly androgens like DHT, which shrink hair follicles and lead to pattern hair loss. Hair loss caused by medications and supplements can often be temporary, resolving once the substance is discontinued or the dosage is adjusted. However, it's important to consult your healthcare provider before making any changes to your prescribed regimen. What can you do? There are options to help manage the situation. While you should always speak to your doctor before altering your medication, there are also diet and lifestyle changes that can support hair growth. In our other video, we cover nutritional tips, stress-reducing techniques, and lifestyle modifications that can naturally promote hair health. And if you're looking for products that complement your treatment plan, we've tested and discovered some excellent solutions that have shown great results. Be sure to check the link in the description to learn more about these products, which are designed to support healthy hair growth without interfering with your medications. We hope this video has provided some clarity on how supplements and medications can affect your hair. If you found this helpful, please consider subscribing to our channel for more health insights and updates. Stay happy, stay healthy, and take care of yourself.